I can now believe the doctors when they say the government ran away from them. They have run away from the committee. They have run away from parliament. How else are we supposed to have this conversation? And because they want us to talk to each other through the media, I've been informed that the chair of the Council of Governors is watching these proceedings from a safe place. I want to tell the chair of the Council of Governors that she has lost my support as one of the people who firmly believe in devolution, as one of the people who actually was going to advocate on the floor of the Senate that the position taken by the COG on division of revenue is the right position. I might just switch and start supporting the Treasury position that these governors, they have no respect for any institution and they don't deserve the money they're asking us for. Honorable Chair, how am I going to argue for extra resources for Anne Waiguru? And yet she has no respect for me. She has no respect for the Senate. She has no respect for any of these members of parliament. I am especially offended because as a young man and a senator of Nairobi, Fridays are not my favorite days to come to work. But I am here, Honorable Chair. That she has chosen to stay away, to run away from me. I want her to know that today she has lost my support. If she sees me on the Senate saying we need to stop even debate on that division of revenue, let them come to the Senate. We will debate that bill when they are seated there, after we finish discussion on this question of doctors. Because, Mr. Speaker, Mr. Chair, when they speak, I saw a cabinet secretary on media speaking about taxpayers' money as if it is his own personal property and telling us for as long as he is there, he will not pay 207,000 to interns, as if it is his money. This money belongs to the people of the Republic of Kenya, and as their representatives, we have powers to allocate that money as and when we please, and in the manner that we think is correct. So, Mr. Speaker, Mr. Chair, I understand that parliamentary business has to be prioritized. So when representatives of ministries come here and tell us, oh, somebody is finishing milking her cows, she will come back after she has fed the cows. I mean, that is absolute contempt.
Devolution was meant to usher servant leadership and not lordship on Kenyans. Chair, we have COG Chair Anne Waiguru. We have the Chair Committee of Health, Governor for Tharaka Nithi. None of them has made any communication to this House. And you know, Chair, maybe we need to remind the country, our CS Health, CS Labor, CS Treasury, the Chair COG, the Chair of Health Committee of Council of Governors, that what we are facing is not a game being watched in a stadium. These are health crises. And unless we find a solution, it still remains a crisis. Any of us can find he or herself in an unfortunate situation where you land into a public hospital. Last year, Chair, we lost an MC who was involved in an accident along Maimaiu. The nearest health facility was Naivasha County Referral Hospital. That's where they were taken. Unfortunately, we lost one. This Friday, in Nyamira, in Nyangoso, we are burying a 62-year-old lady who fell from an avocado tree, was rushed to Nyamira County Referral Hospital. There was no doctor on site. She died. She's being buried today. And yet, we are giving this matter a very casual approach. You can see, Chair, the commitment of all these members of parliament. Because we want value for money for Kenyans. But it seems our governors and our CSS want to derive joy from the suffering of Kenyans. And if it is true, the way Senator Sifuna is putting it, that Chair COG is watching these proceedings from the comfort of our office, I'm telling you, shame on you, Anne Waiguru. Shame on you. And your group of vipers, the way Jesus Christ told the Pharisees. This is a serious matter, Chair. And I want to speak to Dr. Alwach. You say you have been in practice for 56 years. You are representing Kenya Medical Association of Doctors. If you had powers on a day like this, the 24th of April, 2024, you should issue a communique to all the private hospitals, not to attend to all these governors and members of their families, till we find a solution to this problem. We have been put here by Kenyans who have elected us to serve them. A strike cannot exist from 13th of March, 54 days. And people are not taking the issue seriously. It's not right.
Mr. Chairman, what these entities have shown to Parliament is contempt. And we've got the powers. If you read Article 125, read together with Article 153.3, the Cabinet Secretary shall attend, not may attend, shall attend to the committees of either House. Today, Mr. Chairman, the committees of both National Assembly and the Senate are seated here to be able to resolve this crisis. Yet, we are being shown contempt. I've heard my good friends, the PS, saying that the Cabinet Secretary of Health is in another function when this country is bleeding, when people are dying, when hospitals are closed. The Council of Governors, who are busy running around, agreeing to everything they are being told by the executive, and that they know that health is devolved and their hospitals are closed, are not here. The chairperson of SRC, who was involved herself in the matter, that there is a CBA which was agreed upon, is not here. Mr. Chairman, we cannot continue, entertaining such contempt. I concur with the sentiments of my colleague that we need to summon each and every one of these individuals. And as we do so, I think it's about time that we now deal with this issue of this Council of Governors Secretariat being an illegal entity. Because I think if it was domiciled at the ITGRC where the law mandates it to be there, I think they would have taken this matter seriously and be able to come in here. So to be able to save Kenyans and to stop, going dilly-dallying and going around this issue, not knowing what is happening, we must have Treasury here to tell us where the money is. We are the House that have the power of the purse. We are the ones who are now discussing the division of revenue bill. If there is a CBA that had already been agreed upon, why is it not implemented? So, Mr. Chairman, my view is as follows. This meeting cannot continue. Those governors, the Council of Governors, including even the chair of health of the Council of Governors, who is not here, must be summoned to be able to come here and give the way forward. A matter cannot come to this House and we continue playing politics on it.
Chair, as a Mogotio proverb, which says, when I chair and I repeat, if the sun claims superiority over the moon, let it shine at night. The same Council of Governors will come to us and seek for further addition of revenue. They'll come for us asking for budget. And at the moment when we want to discuss issue, they are claiming superiority. Chair, we want to tell them shame on you, because these are very sensitive and serious matter. We should be taken serious by each and every stakeholder in this sector. I agree with Sifuna that finding the 500,000 is like, asking them for a cup of coffee. In fact, 2 million, Sifuna is a bit small, should be 5 million. An equivalent maybe 6 months in jail for contempt of this respectable House chair. Chair, and we should start with Madam Waiguru and Mutomi Njoki, because the two of them are the face of this arrogance, and they seem not to care about people dying. They don't even remit their money to KEMSA, Chair. You get hospitals, they don't have money. You ask KEMSA why they don't supply drugs. They tell you they delay to remit the money for paying for drugs in KEMSA. These governors are actually the worst cohort of governors since we started devolution in 2013. I think the Mandago team was better. Mandago, I think maybe we should congratulate you, and we should give you a standing ovation because your team was a bit more sober and serious. But I think this one we elected a bunch of excited, arrogant fellas to be our governors, and they're leading us down the street without even caring that people are dying. But in your wisdom, our two chairs, in your wisdom, you should tell us what to do with this bunch of arrogant governors. Either we starve them the budget, or we can make a painful and emotive decision to return the health back to national government. As much as we are saying, we devolved it for posterity, and the drafters of that constitution, Omogeni was part of them, had good intentions. So, and they know arrogant people will not be in charge of our counties. They gave them this mandate to oversee our health services. But if they continue with this arrogance, we are left with one option to return. We better deal with one animal called CS and do PSS than dealing with 7 bunch of arrogant fellas down there, which we don't know which one to start with, which one to end with.
For example, they were losing over 10 people a day, mothers and children. And Chair, it appears to me that perhaps the previous failures of these meetings is that it's not taken seriously. That's why meetings have been aborted. I could not imagine that COG could fail to attend such a meeting. Perhaps we need to interrogate our constitution, whether COG exists legally or is just a mere club. Number 2, the Ministry of Labor and Treasury with junior representation. Chair, how would you attend meetings in World Bank when your house is on fire? And all the excuses that we have had in these apologies, how can that be? So my submission, Chair, is that Parliament is the highest apex, is the highest institution on this land, and Kenyans are looking upon us to have some reprieve, to have some solution to them, to their crisis. And if Parliament is not respected, we have in our standing orders, Chair, that we should invoke. Number 1, to summon those who have not attended. That means I'm suggesting this meeting cannot go on without COG and all other important stakeholders, and put them on summon as soon as possible, as our standing order says, so that we have all the players on table and come up with a resolution to save the lives of Kenyans. So, Chair, I suggest we stand this down and evoke our summons so that we have a full house that can make a resolution that abides and can help Kenyans.